It began as a remote expedition voyage, a journey across isolated waters aboard a luxury exploration ship carrying passengers from around the world. But within weeks, that voyage would transform into an international medical emergency, and a virus rarely seen outside isolated outbreaks would suddenly trigger global concern. The ship was called the MV Hondius, a Dutch expedition cruise vessel operating near the southern edge of South America. Passengers boarded expecting wildlife, glaciers, and remote landscapes. Instead, they would become part of a rapidly unfolding health crisis. Investigators believe the chain of infection may have started during a birdwatching excursion near Ushuaia, Argentina. It was there, at the southernmost tip of the continent, that exposure may have occurred. The suspected source, a rare and dangerous strain of hantavirus, known as the Andes strain. Unlike most hantaviruses, which spread through contact with infected rodent particles, the Andes strain carries a far more alarming characteristic. It can spread between humans. Though rare, close physical contact may be enough, and that possibility immediately changed the situation from isolated outbreak to international threat. At first, the symptoms appeared unclear: fatigue, breathing difficulty, fever. But conditions rapidly worsened. Soon, passengers required emergency medical intervention. Then came the deaths. A Dutch passenger died aboard the ship. Days later, his wife also died after leaving the vessel. A German woman became the third confirmed fatality. Health authorities began racing against time. As the ship crossed the Atlantic, concern spread across multiple continents. Passengers had already disembarked in remote territories. Others had boarded international flights. Some returned home before the outbreak was fully understood. The cruise vessel remained anchored near Cape Verde under growing scrutiny. Medical evacuations followed. Critical patients were transferred to hospitals in Europe and South Africa. Among them, a retired British police officer, a Dutch crew member, a German passenger in serious condition, and additional suspected infections across multiple countries. Meanwhile, health agencies launched urgent contact tracing operations. Authorities in Europe, Africa, and the United States began monitoring former passengers and possible exposures. Even aviation personnel were drawn into the investigation after contact with infected travelers. The challenge facing experts was not simply the virus itself, but uncertainty, because hantavirus outbreaks are rare, and the Andes strain remains one of the few known variants capable of human transmission. Inside hospitals, specialists monitored patients for signs of hantavirus pulmonary syndrome, a condition capable of causing severe respiratory failure. In serious cases, mortality rates can approach 35%. Yet global experts urged caution against panic. The World Health Organization stated that this was not another COVID-19 scenario. Transmission appeared limited to prolonged close exposure, but even limited spread aboard an international vessel revealed how quickly modern travel can complicate containment. As the MV Hondius sailed toward Tenerife, authorities prepared emergency protocols. Passengers would be assessed individually, some quarantined, others repatriated under medical supervision. Every movement now carried risk calculations. For the people still on board, uncertainty became part of daily life. Cabins became isolation zones. Meals were controlled. Medical monitoring intensified. And beyond the ship's walls, headlines began spreading faster than the virus itself. The incident became a reminder of something the modern world learned only recently. Global connectivity can transform local outbreaks into international emergencies within days. Today, investigators continue tracing the origins of the outbreak. Scientists continue studying transmission patterns, and health agencies continue monitoring potential secondary cases. But long after the emergency fades, the questions remain. How prepared is the world for rare diseases crossing borders unnoticed? How many outbreaks begin silently before detection? And in an age of global travel, can containment ever truly move faster than exposure? Because sometimes, the next global crisis does not begin in a laboratory or on a battlefield. Sometimes, it begins quietly, far from land, in the middle of the ocean.